From bump to baby, having the right care team can make all the difference, especially for new moms. Here to share how they're supporting families every step of the way is Dr. Layla Yunus, Director of Women's Health and Dignity Health East Valley. Welcome.
Thank you very much. Thank you for having me here this morning.
Well, what you do is very old-fashioned at the clinic there because family medicine feels like something out of the 50s when somebody else gave you full service at the gas station. You take care of a woman prenatally, and then the newborn, and then throughout pediatric care and into adulthood.
Yeah.
So it's the whole thing.
Yeah. Yeah, so I really love family medicine for that reason. At Dignity Health, they gave me this great opportunity after I finished my training. After family medicine residency, I went and did a specialization to get surgical OB. So I'm trained to do C-sections and more complex OB care. So I came to Dignity afterwards to work for the family medicine residency clinic. And there we do, I think standard family medicine that everyone's kind of used to, comprehensive care, their PCP, but we offer so much more than that. We can offer prenatal services and, like you said, follow the mom during her prenatal journey and then also deliver her, and then once that's over, take care of her and baby, and then even past the postpartum period, still continue to be her primary care physician, if that's something that she so chooses, and then keep following that kid, and once they turn 18 or 21, they won't age out of our clinic. They can continue to see us.
This is making me smile because I remember thinking like, oh no, now I've got to find a different doctor for me, a different doctor for my kid, and there's a continuity that's really helpful. This doctor knew what my pregnancy was like. This doctor knew what the birth was like. This doctor knows about a rash my kid had when they were 3.
Yeah.
And now this is a teenager.
Yeah. So I love seeing families, and I think for us, we really, at Dignity Health Family Medicine, we want to be partners with patients and their families. So for us, we want to get to know you, not only your past medical history, but, what your family history is. What's your lifestyle like? What are your beliefs? What are your personal preferences? And for me, I think taking care of families as a whole helps me to better understand the families, the patients, and be their healthcare partner.
And I know these days medical professionals are a front line for mental health issues as well, and that must be helpful to know the whole family system.
Absolutely. Like understanding family dynamics really helps to contribute to that. And we're lucky, as part of family care and your wellness visits, we screen for things like depression and anxiety. We can manage those things. If there's patients that require higher level care, we have partners within Dignity that we can refer you to. And then we're also very lucky in our residency clinic that we actually have a licensed social worker who helps a lot of our patients with resources they may need as well.
So let's talk nitty-gritty about the procedures that you actually do at Dignity Health. You're not farmed out. You don't have to go somewhere else. You can get a pap smear?
We can do pap smears, yep.
An x-ray?
Yeah, x-ray, we have to send you out for that, unfortunately, but not too far.
Blood work?
Blood work, yep. We have a lab on the same floor as well.
And you do procedures? We
do procedures. So a lot of people are surprised to find that we do procedures. So we can do things like joint injections. If someone needs an IUD, for example, we can place one of those. We do newborn circumcisions as well. And then we even do things like toenail removals and some skin procedures as well.
I know you're excited about the toenail.
Super excited.
Don't try to hide it. But listen, I've got an 81-year-old dad who I take care of, and he does have the foot issues.
Does he? Well, he can come see us. And, I think for us as family medicine, it's striking a balance. We will take care of everything that we can. But if it gets to the point that we think you do need to see a specialist, we will do our due diligence and send you to get that higher level of care if you need it.
I feel like in this moment in time, medical care is so siloed.
Yes.
You go to this expert for this, and this one for that, and that one for that, and maybe they don't engage with each other to get a whole sense of how somebody is feeling.
Yeah, absolutely. And I think for me, how I think of myself as your family medicine provider and your primary care, I kind of want to be the ringleader of all that, so I will see you, I want to take care of you as much as I can, and then if I'm sending you to the specialist, making sure, hey, I'm getting communication back from those offices, and then checking in with you like, hey, I got this note from this specialist and they were recommending this, how are we doing with that, and making sure a patient understood the recommendation recommendations. You know, they picked up that medication if that was discussed, and that way making sure we're all on the same page and nothing's falling through the cracks.
Dr. Eunice, I think I would love you to be the ringleader, not just of my medical care, but my whole life. Dignity Health, it's in the East Valley.
Yes.
Are you taking new patients?
Yes, so we have a ton of providers. So we actually have 6 attending physicians. So those are doctors that have completed both med school and residency training. And then we also have 18 resident physicians. So those are doctors who have completed medical school and are now getting their specialty training in family medicine. So we have a lot of availability in our clinic right now as well. And we can, because we have so many providers and trainees, can really get people in within a few days to be seen.
Thank you so much, Dr. Eunice.
Thank you.
And of course, you can always find more information on our website, cw7az.com. Thank you so much.
Thank you.
The preceding portion of the Arizona Daily Mix was sponsored by Dignity Health.